Good afternoon, everyone. And we are so excited and like to welcome you today to the 77th edition of the Flint Community Webinar on Coronavirus, this Thursday of September 2021. And now for these many weeks, we've been able to come together and join with you in learning more about what's happening with the coronavirus and other very, very important issues in our community. And we are excited that this webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center. So again, good afternoon. My name is Yvonne Lewis. I'm the co-director of the Healthy Flint Research Coordinating Center. And we're just excited, along with all the partners that we've been able to amass to be with you each week, to share with you information that still brings a relevant, and local context to the issues that we are facing surrounding the coronavirus. So I want to appreciate our co-directors from Michigan State University, University of Michigan Flint, and the University of Michigan Ann Arbor for working to, again, just make sure that we're doing our best to bring relevant information to you. We're streaming live, Facebook and YouTube, a wonderful thing today. This amazing technology allows us to bring this information to you. So if you're listening in and you know people that you think that would benefit from the information, you still have time to send them the link so they can join us in the webinar today. We look forward to your feedback. We're going to ask you, as we do each week, to put your questions in the Q&A because we have wonderful partners that are going to help address them for you today. Our key issues for today that we're going to be talking about is a lot of conversation around the mask. So we're going to talk about the match test. We're going to have a medical moment, and it's going to be just an exciting opportunity for us to see a real practical way to understand some of these issues. We're going to have an additional update from the health department. We're going to see where we can find locations for vaccine testing as well as vaccinations. We'll hear an update from the governor's office and, of course, an update from the city of Flint. Again, if you are joining us by YouTube and you have questions that you would like us to answer, you can feel free to send a note to us at info@hfrcc.org. We appreciate hearing your comments, or you can give us a call today at 810-835-2130 to share your questions or comments. If you are in the webinar, we do want to make sure you put those questions in the Q&A so our team can answer them for you. I want to remind you once again, because we're often asked why we're doing this webinar, is because we want to bring to you, our community members, the local context, what's happening in our local community. That means Flint, Genesee County, and how we can utilize the information to move forward. With this in mind, we're going to provide these wonderful updates for you. Our panelists, I want to just give them a shout out today. Our panelists that are going to be waiting to hear from you will be representatives from the university. Gary Jones is here, Jim Melanowski, Dr. Lawrence Reynolds, Sherelle Brown is here, Susan Wolford, and other representatives from the community will be in the background ready to answer questions for you. So let's get started today. We talk about the mask wearing and the match test. Some of you may be wondering what this is. Well, many people have asked, and I just heard this conversation the other day that I should be wearing a couple of masks, wearing 2 masks. And I asked a question about this. So we're going to give you some examples of how you can be sure if your mask or mask, as Dr. Woodford would say, if it is appropriate. So let's look now and understand what the match test really is.
Hi, I'm Deborah Reynolds. I'm an epidemiologist and the Associate Dean of Public Health Integration at the Michigan State University. I often get asked the question, will my mask protect me from the coronavirus? To answer the question, I want to show you the match test. The match test is simple. You hold a match 6 inches in front of your face. If you can blow that match out with your mask on, chances are the mask is not sufficient to protect others from you or to protect you from others. To do this test, I've invited my good friend and colleague, fellow epidemiologist, Dr. Maika Smart. Let's do the match test. First up is the standard blue disposable mask. You find these in convenience stores, big box stores, and online retailers. Notice how Dr. Smart put it on by the straps. If it's too loose on the face, you can always use 2 fingers, pinch it at the nose. This is appropriate because this is a new mask. Let's see if it passes the match test. Standard blue disposable mask passes the match test. Next up is a handmade fabric mask. It's 1 layer. It doesn't have a filter inside. It's a standard handmade 1 layer fabric mask. Let's see if it passes the match test. Standard handmade mask, fabric, 1 layer, passes the match test. Up next is the bandana. We see people wearing these all the time. Notice again, Dr. Smart's tying it from the back, which would be the equivalent of the straps. Let's see if it passes the match test. A standard bandana folded over twice, 2 layers, doubled up, passes the match test. Let's say you're out and you've forgotten your mask. You reach down, you pull your scarf up, thinking it'll keep you safe and protected. Let's see if it passes the match test. Your scarf does not pass the match test. Well, that was the mask test. And as you can see, the standard mask that we use, whether it be a standard disposable mask, a homemade single layer fabric mask, or a bandana doubled up, pass the match test. Remember, if you come out without your mask, pulling a single layer scarf up might not get the job done. Be safe, everybody, and remember, mask up. And thank you, Dr. Smart, for helping us out on this test.
All right. Thank you, Dr. Deborah, and thank you, Dr. Smart. Now I need a roundtable team. I need to hear from Dr. Deborah again. I also want to hear from Dr. Reynolds, Dr. Hacker, and Dr. Wolford. You may want to chime in here as well. Dr. Deborah, now you and I had to call you this week because I told you I heard on the national news before I decided to go on a national news break, a doctor explaining how to create this mask with 2 layers with a little something in between it, in between the 2 layers, because I need it now with the Delta variant, this added protection. Can you help me? I mean, you just showed us the match test. Is it necessary for people to go this extra and double up now with masks?
Here's what I always tell people. This is the time not to do the most, nor to do the least. My concern is if people are wearing 3 and 4 and 5 layers of mask, it won't be sustainable. And it actually will be difficult for them to breathe, and it won't add any additional protection. Quite the contrary, the more layers of mask, the more things you have to manage, taking on, taking off, and making sure that they're sanitized and cleaned and all of those things. The reason we decided to, we did that match test probably a year ago. The reason we decided to bring that back is to give people some very basic and practical tools on how to protect themselves. So if people are wearing 2 and 3 and 4 and 5 layers, that won't be sustainable. I think it'll be hard for people to breathe, and it might deter them from just wearing one good single layer mask that they wear appropriately, that they're changing, and like that.
Well, thank you, Dr. Deborah, because I will tell you, I heard that just before I got on the airplane. So I tried it, and I had the mask on. I pulled the alligator that I got from the Genesee Community Health Center at an event. I could not breathe. So I can imagine the challenge for people who have breathing difficulties already trying to do that. So this is why our webinar is so important. You're hearing credible information from folks right here. So I know we hear the national news, but let's listen to some of our own folks. So Dr. Reynolds, I see you. What do you say to this?
I found that very instructive, and we should always remember these are layers of protection, and that's all I'll say about that. And there are other considerations: that we maintain our physical distance, we avoid dense crowds, and we consider how long we stay in a situation where there are unmasked people, a poorly ventilated spot, and the crowd is dense. And that does bring up some information for how we should think about the Labor Day holiday. If you pack the house that's probably not the wisest location. Do outside what you can do outside. And I said it on our last holiday, please watch your consumption of brain influencing substances. That includes alcohol, among other things, because you don't want to be around someone who's not sober, who's not making good choices. You should be concerned about how they drive when you put them out. But these are things that we should consider in our social gatherings.
Thank you, Dr. Reynolds. Again, we've got a lot going on coming up, a holiday. These are things we should consider. Now, I want to ask too, Dr. Woodford, just quickly, I know you're going to give us some insights later, but I want to ask you too, when we talk about this as it relates to children and some of the challenges they might face.
So I think that, thank you so much, Yvonne. I think that the question with children, it's important to think about the age, right? So the AAP and others recommend that children under 2 shouldn't wear a mask, but over 2, they're very able to wear a mask. And in fact, many of them really like it now, right? They have superheroes on them and they love it. So we can encourage any child over 2 who is developmentally without any challenges, then they can do it. Of course, if somebody has challenges and if for them it will be difficult, then that's a unique situation that should be handled sensitively and appropriately. But otherwise, for children without any special challenges, they should be able to wear a mask. And particularly because they cannot be vaccinated yet, it is very important for us to teach them that skill. Teaching them a skill that will help save possibly, if not their life, the life of somebody around them who might catch coronavirus if they take it home.
Thank you, Dr. Woodford. And that really leads us to this next piece of conversation I want to have when inviting Dr. Pamela Hackett, who is our health officer for the city, for Flint and Genesee County. Dr. Hackett, you did something extraordinary and led the way on this for the state with respect to a mask mandate. And I know it's been challenging for you, but you have many people who are applauding you for standing up because others can't speak for themselves. So Dr. Hackett, can you give us an update on that?
Sure, thank you, it's very kind. I am just someone who's always been very medical evidence driven. And I do realize that we always have these caveats of a certain, it's like 95%. And so there's 1 out of 20 times, something is not as we think it's going to turn out. But nonetheless, like that's why we have scientific, pursuit of knowledge and keep on testing things to make sure we can tie that down as much as possible. So as our numbers change, we've been watching those as the cases in certain different areas of ages change. First we were very concerned about the elderly, and then the concern was more going down to the people with medical risks. So what we've been looking at now with the start of school is the school ages. And first, while numbers were still coming in and data was still coming in, it was just clear that persons who were 5 to 11, just they don't have that opportunity to get vaccinated yet. Our goal is to have them in school. And that's why the first mandate was put out. And our numbers were still low, moderate when that they were starting to creep up, but they were on the way up. And so now our numbers really had jumped up quite a bit. It's been over like a 2,000% increase since July, I think, for our case numbers. And I don't have that at my fingertips. I have epidemiologists who could give the exact numbers and exact times, but nonetheless, it is clear that it's going up. And I also have the concern about trying to quarantine so many children, keeping them at home, interrupting the families' activities and interrupting their school, most importantly. So looking at the different options, we know that masks are a huge aid to reducing transmission. And we also know that they are safe. And when you look at who's been wearing masks in childhood the very most for the last several decades, it's children who are undergoing chemotherapy. And so these are the very, very most vulnerable children. They're wearing masks. They're not getting sick from wearing their masks. And so with that, with the start of the school year, a few of our early opening schools, we were seeing numbers go from 1 or 2 up to 40 in less than 2 weeks, or about 2 weeks. And that's why yesterday we came out with the pre-K through 12th grade mask mandate. Once you have universal masking, we have more options. We have the options that are been outlined by the CDC to reduce the days of quarantine down to 10. So we are doing that. And we also have options to reduce the definition of a close contact down from 6 feet to 3 feet. I am still actually, I was just actually Googling risk of transmission of COVID with both parties masked, but within 3 feet, because I would really like to be able just to say, if both parties are wearing a well-fitted mask, there's no quarantine. But I want to look at what is most recent on that. But so each day I actually am trying to check what is the best evidence, the best science. I evaluate the study as to whether it's a good study or not. There's some studies that are being spread around, one in particular that only had, I think, like 11 masks examined, saying you can catch all these different diseases, but that was not a good study whatsoever. So that's where we would like to go, and we are also considering additional options to keep children in schools safely.
Thank you, Dr. Hackert. And of course, this is an interest to all of us. I have two grannies, and two grannies who are in school in Texas. And sometimes they're the anomaly because they're wearing their mask and it's not required in Texas. So to have you looking out for us as a whole community, we appreciate that. So thank you so much. I want to go back to Dr. Deborah as we prepare to close this roundtable segment out this morning, or excuse me, this afternoon. Dr. Deborah, talk a little bit about what it means. I know Dr. Hackert mentioned, getting back to epidemiologists, about this 2,000% increase. Can you just give us quickly what that means and give us your last word on the mask test, the mask match test?
I missed the 2,000%
That's hard
increase.
That's hard
I know.
to say. Mask match test.
The mask match test. Let's just call it the match test. It's just a simple way to know if your mask is working. And again, you know, you still have to be able to breathe. And I've really been tickled at listening to some of the things that people have to say about these masks, when those typical surgical masks are what people are wearing in ORs when they're operating or they're assisting and things like that. Like these masks are sufficient, and they function the best when everybody has one on. It's called synergy. It's where something becomes greater than the sum of its parts. So we get this synergistic effect when everybody in the space has on a mask. And I, again, remind people, don't do the most, but don't do the least. The least would be not wearing your mask. The least would be wearing a disposable mask for days and days and days. The least would be wearing a fabric mask and not washing it each day, right? So don't do the least, but then also don't do the most. There's no need for people to wear multiple masks or multiple layers. It actually potentially could increase the risk of cross-contamination, and it'll make it really hard for people to breathe. And that might be a deterrent for them wearing a mask at all. One mask is sufficient.
Thank you so much, Dr. Deborah. It's a lot for us to learn. We can't get it all in a day. So that's why we need to tune in every week. Your questions actually help us to figure out what we need to do next. These are questions that we're hearing in community, and we want to just make sure that we're able to ask, get those questions answered. Dr. Deborah, I want to just share this because one of our participants said, Doctor, I would have loved for you to do that demonstration at the mask mandate protest that took place last week at the commissioners meeting. Dr. Hackert. So you're getting support, Dr. Hackert, and these are ways that we can continue to get this word out to individuals who need to get the right information and not just some information that cannot be viewed as credible. So thank you so much for all that you're doing. Gary Jones. Gary, we know that you are our state representative and always bringing us wonderful information from the governor's office. So we're looking forward to hearing what you have as updates for us this week.
Thank you so much, Yvonne. Forgive me, everyone. I'm off camera today, actually on the road. I'm literally picking up my daughter right now. So if you hear random 3-year-old noises in the background, that's exactly what that is. So today, Governor Whitmer issued the following statement after Wayne County announced a mask requirement for schools, which brings the total number of school districts in Michigan with a mask policy to 179, covering more than 674,000 students, or 53.8% of students in traditional public schools in Michigan. After 19 months, quote, after 19 months of COVID, the science is clear. Vaccines and masks keep kids safe and help them continue learning in person. On vaccines, the message is simple. Every eligible Michigander 12 and older should get their safe, effective, and FDA approved vaccine to protect themselves, their loved ones, and their community. On masks, both the Michigan Department of Health and Human Services and the CDC have strongly recommended that districts require masks for students, teachers, and staff in schools, regardless of vaccination status, because it will allow them and everyone to stay safe while continuing to learn and grow in person. The governor agrees with our top health experts. As of today, again, 179 districts, totaling over 53% of Michigan students are covered by mask requirements. Thank you, Dr. Hacker, for your leadership in that endeavor. It was implemented by their schools or their local county health department, in our case in Genesee County. That number has increased substantially over the last few weeks, and we expect to see that trend continue as the first day of school approaches. Districts actually and local public health leaders should continue to keep working together to implement mask guidelines and create buy-in at the community level, which leads to better outcomes and better adherence to policy that keep kids, teachers, staff, and parents safe. Together, we can protect ourselves from COVID and ensure kids keep learning in person, end quote. Earlier this week in Flint, Lieutenant Governor Gilchrist made a stop on his Thriving Cities tour. Back in 2019, in the beginning of the administration, the Lieutenant Governor started Thriving Cities by holding conversations across Michigan to hear directly from community members inside of cities. This year will be 25 cities that he will be visiting. This phase will allow the tangible impacts of the game-changing investments the Whitmer-Gilchrist administration has made to help cities thrive and explore ongoing underlying challenges that they face. Also recently, as of yesterday, the Lieutenant Governor toured GenUC in Flint following remarks at the Flint Regional Small Business Summit, which brought together small business owners, advocates, support organizations, and lenders from Flint and across Genesee County as part of a statewide effort to inform a comprehensive strategy for small business investment in Michigan. And lastly, Lieutenant Governor, he was also recently named as Midwest Region Chair for the National Lieutenant Governors Association. Of course, again, he is the first Black Lieutenant Governor for the state of Michigan. In this position with the NLGA, this is a professional association supporting lieutenant governors and the office holders first in line of succession to governors in all 50 states and the U.S. territories. And their goal is for being effective and as efficient as possible for their constituents. And as always like to plug the catch-all websites, michigan.gov/COVID vaccine, as well as michigan.gov/coronavirus. It's still the best place to keep updated with everything.
Thank you so much, Gary. Appreciate that update. And again, seeing that Flint Genesee County is a leader in so many ways, let's continue to keep this up as a county. Flint is just an amazing community. Before we're going to hear from you, Sherelle, I just want to ask Dr. Hacker, did you have another comment that you wanted to make? I know you have to leave us early today. We appreciate you being on. Was there an additional comment you'd like to make before we hear the updates from Sherelle? Okay, maybe she's already had to jump off to another call. Sherelle, Health Department. You are the emergency preparedness health educator. Good afternoon.
Hi, how are you today?
Wonderful.
Awesome. So Dr. Hacker did mention the new mask directive, and I just want to give special thanks to Dr. Hacker because I have 4 children in school that range from K through 12, and I appreciate that mask mandate. So as you all know, K through 12 have received the directive to wear a mask. that started on Tuesday, September 7th, and it will be in effect for at least until we go back into moderate transmission across Genesee County. We must see that for a consecutive 14 days before that directive changes. And that is a mask update that I wanted to let the community know about. Next slide. We are still continuing our COVID-19 vaccination efforts in Genesee County. Across Genesee County, we've reached over 337,000 doses administered throughout the county, and those totals continue to rise weekly. I compared last week to this week, and we saw about over 3,000 more vaccines from just a week ago. So that's awesome. We are seeing a new trend in cases of increased COVID-19 rates. Just last week, we went from 390 cases to 479 confirmed cases. That's a 23% increase in COVID-19 cases. So it's important that we keep our babies masked up in school and that we continue to come out and get our vaccines and finish the 2-dose series if we are receiving Pfizer or Moderna. Next slide. So we do have our upcoming clinic times, as you all know. The ones that have a red asterisk next to it are our standing clinics. So they are provided every Tuesday, Wednesday, and Thursday at Our Lady of Guadalupe Church, Central Church of the Nazarene, and Shiloh Missionary Baptist Church. We are offering first dose Moderna and Pfizer, as well as Johnson & Johnson on Wednesdays at our standing clinic, and then our Tuesday and Thursday clinic will be offering just the Moderna and Pfizer. This Friday, today, from 4 to 5, will be at the Sarvis Park. You can come out from 4 to 5 to receive a vaccination. We'll have all three, so you do have a choice. And then this Saturday, if you weren't able to make it today, we'll be at the Hasselbring Senior Center, and that's located on Home Avenue from 6 to 7. We'll have Pfizer and Moderna, as well as J&J vaccine available to our community members. Next slide, please. And with that being said, we ask that you continue to reach out for testing, especially if you are in large crowds or if you come in contact with those in public who aren't wearing a mask, because we don't know everyone's status. So in the community, we have Genesee Community Health Center, as well as Hamilton Community Health Network, Word of Life Church, Bethel United Methodist Church, Macedonia Baptist Church, and your local Walgreens and Rite Aid. And they do offer the rapid antigen testing as well as PCR testing. You must request which test you need. If you have not been able to get out to any of our sites, or if you are homebound, you can contact the Genesee County Health Department at 810-344-4800 or visit us at gchd.us to sign up and get on the list so that we can come out to your home and provide you with that vaccination of your choice.
Thank you so much, Sherelle, and we appreciate your information because as you mentioned, there was an increase in the number of vaccines that happened last week, and there's just a tremendous partnership with the health department and other organizations that are out in our community making sure vaccines are available. Because, you know, at one point, people were saying they couldn't get the vaccine. We didn't have enough vaccines. And now we have community groups doing vaccines every week. Just to give a shout out to a couple, the Genesee Community Health Center has their mobile unit going around to various community organized events by community organizations and churches. The Greater Flint Health Coalition, along with United Way and the Genesee Community Action Resource Department, GCAR, are connecting on Meetup and Eat Up. So they're bringing the mobile unit into the community and also connecting it with some food that was going on. So there are a lot of opportunities, and we appreciate the work that the partners are doing together to make a difference and make these vaccines accessible. I also want to mention, because you talked about the testing, Dr. Reynolds reminds us about cadence testing. That's that regular testing. So Sherelle, do you recommend that people get tested more than just when they think they've got been exposed, or on a routine basis?
Most definitely. It should be weekly like it was before, as we're seeing that increase throughout the community. Transmission is high. So like I said, if you've been around people who haven't had a mask on, or if you've been in large crowds, get a test. It won't hurt to know.
Thank you so much, Sherelle. Appreciate that update from the health department. Let's keep working together. Now, here's where we get some additional news about this. Dr. Reynolds mentioned a little bit earlier about layers of protection. Dr. Susan Wolford, who has been doing amazing examples and demonstrations about how we stay protected, is going to share with us a little bit about the importance of this layers of protection. We talked about the mask, or as you would say, Dr. Wolford, the mask. But what you told us before is that's not enough. It's good, but it's not enough. What else do we need to know?
So I think, Yvonne, thank you so much for that question and for this opportunity. As I was planning for today, I ended up having an experience yesterday evening that really what I want to do today is testify about the wisdom of layers, right? So yesterday or last night, we were driving from Chicago and 2 tires blew out in our car. Now, at that moment, well, one blew and one went flat, wild, middle of the night, middle of nowhere. But there was traffic all around us. It could have been horribly dangerous. But the beauty of this is that we had seatbelts on. There are airbags in the car. The car has good brakes and special steering that if the tires go out, you can still keep control. When you encounter a danger, you want as many layers of protection as you could have. And I wouldn't be willing to have gotten rid of any of those. And so I'm glad to be able to be here today to do this presentation because of the layers of protection that we had in the car that we were driving. The same, I would say, is true of coronavirus. So I'd like us to think about the different layers. And we constantly talk about the Swiss cheese. So I couldn't get Swiss cheese for today, but my niece very kindly made me something to simulate Swiss cheese. So let us imagine that this is distancing. So if we distance this weekend, when we are spending time indoors with other people and we distance, it's a good thing. It will block some of the virus from getting through, but not all of it. Some is going to get through, but that's not all, right? So if we, on top of our distancing, add masking, if we add a layer that is our mask, and we put that on top of our distancing, and we come in contact with somebody who has coronavirus, we, better protected, right? Some is going to get through, but hopefully we're going to be better protected. And we don't have to just have the mask and the distancing. Of course, all of us hopefully already have the vaccine. And notice that I asked my niece Samantha to make the vaccine holes infinitely smaller than everything else, because the vaccine, while there are breakthrough infections, they're very few compared to how many cases occur if you're not vaccinated. We knew it was only 95% protective in the first place, so we expected 5% of cases, and it's very good at that. And even in the face of the Delta variant, while there's more than 5% that can break through, it is still so much better than the being unvaccinated. And the cases, as we know, are much, much milder and much less likely to cause death or hospitalization. So we put over that layer our vaccine layer, and then we see how do we do if we come in contact with coronavirus this weekend. much, much better. So I hope that helps you see that we don't want to be out there with just distancing. We want distancing, but not just distancing and masking. We want distancing, masking, having the vaccine, not spending too long in the same place, washing our hands, having ventilation. By the time you do all of that, you've put yourself in the best possible situation for staying healthy.
Thank you, Dr. Wolford. Can I just pick up on something you just said, because you mentioned ventilation as one measure. Can you talk a little bit more about ventilation? We know we say outside is better, but what about inside?
So you want a good current of air. That is a fabulous question. We want a really good current of air. So if there's coronavirus that is around, and we have an air current, if I spray, and I don't want to do that, but if I spray and I have a fan, it's going to blow it away. So we want the current to move through the house, move through the place, so that it can take that, we can have that stream of fresh air coming in. And we don't want those particles staying, just drifting in the atmosphere, so that we can breathe it in and then be more likely to get coronavirus.
So thank you, Dr. Wolford. So on all of the layers, even in our homes, because we still may have people coming in and out, is to have some good ventilation all the time.
Absolutely. And
one of those,
if possible, be outside. If possible,
yeah.
Especially this weekend with all the activities, if you can, do them outside.
Thank you so much, Dr. Wolford. We appreciate that wonderful demonstration. Next, we're going to hear from the city of Flint. We often want to hear what's going on at the mayor's office. And I understand Kiana Towns-Williams is going to be here with us instead of Lottie Ferguson, but we appreciate Kiana for coming. So Kiana, tell us what's going on out of the mayor's office.
All right, good afternoon. Yep, good afternoon, everybody, and happy holiday weekend. I'll be brief today, just a few updates. First, beginning with the sampling from the Michigan Department of Health and Human Services. Just an update that they have at this point finished their first round of testing. So what's happened is MDHHS has identified homes to continue testing during the onboarding of the secondary water source. And they have completed testing at 50 plus homes and will continue to test those homes in future rounds. So once they're back out in the community, we'll go ahead and bring an update, make sure we share that out. But it sounds like they'll be testing at the same homes at that time. This Tuesday, that makes it, I don't have my dates here. Give me just a second. On September 7th at 5:30 is the special meeting for the Water System Advisory Council. And that meeting is going to be virtual. All of the meeting notifications are posted here in all of the regular places at City Hall, front door, back door, near Human Resources. And also that information is available on the city's website. And then just a reminder that City Hall is closed on Monday for the holiday, and for residents that the trash will be delayed for one day. So if your trash is usually picked up on Monday, that will happen on Tuesday. So those are the only updates I have from the city this weekend. I hope everybody has a good holiday weekend.
Thank you, Kiana. Just appreciate that. Just a quick question. So City Hall will be closed on Monday?
Yes, that's correct.
Okay, and people are still able, if they need to get some supplies from City Hall, but it would be on the, other than on Tuesday, beginning on Tuesday of next week, they'll still be able to get supplies from City Hall if they need them.
Yes, thanks for that clarification. The information desk will be back open on Tuesday at 9 a.m. For those resources. And also the Family Navigators will be back out in the community next week at several events, including the help centers. So on Tuesday, they'll be at Asbury, and on Thursday at Greater Holy Temple with those same supplies. So they'll have filtration systems, cartridge replacements. We did get some pictures as well. So we'll have a couple of pictures available, and cartridge replacements and recycle bags.
So when you say pictures, you mean those zero water pictures? And
Yes, but
people really
I
love to
think
get them.
they may have been upgraded. They're the pure ones this go round that we
Okay.
were able to get. We don't have a large supply of them, but we do have a couple of them, and we'll have them at the help centers and at the information desk.
Thank you so much, Kiana. We appreciate that. We just want our community to know this is another opportunity, particularly for those of you that are out and about and helping our community members understand what resources are available. This is let us know that there's still attention being given to the situation as it relates to the water crisis. At some point, we're looking to have a different conversation about this, but now we want to make sure that our community really understands there is still help available. Thank you so much, Kiana. And now let's move to understanding the policy brief. Dr. Deborah Holden is a resident epidemiologist. And Dr. Deborah asked you a question earlier. I don't know if I made myself clear, but we just want you to continue on that conversation about what's important about us understanding the data and what's it look like for addressing the disparities that we've been seeing.
Well, so the thing that we want to know is that spread is continuing. I think Sherelle really hit that nail on the head, and I really appreciate the work that they're doing to give us the percentage of that increase. What we're trying to focus on with the equity brief is to keep that eye toward equity. You know, we've been pretty proud in Flint of the work, Flint and Genesee County, of the work that we did to close the racial disparities gap in COVID. But data is important because without the data, how can we really say if that gap is remaining closed or not? So if you actually look at what cases look like for this week, like Sherelle said, go to the next slide, please. Like Sherelle said, the cases are increasing, but notice the number of unknown race for the cases is pretty big. This week, look in Genesee County, we've got 160 cases. That's more than half of the cases. We don't know the race of the person, you know, who was positive. And a big part of that problem is because people just aren't asking. And so I think it's important that we continue to do the work and to advocate for, we've got to be collecting that data. We need to be collecting the data on who's contracting COVID. We need to be collecting the data on who's getting vaccinated. Otherwise, it'll be hard to say whether or not we've actually, our strides that we made and the work that we did is being undone as we start to see cases steadily increase. The other issue that we have is we've got a demand for testing, right? So our testing positivity rate was 10.5%, now it's 10.9%. That might seem trivial to people, but the point is it's going in the wrong way. 10% is pretty high. That means 1 in every 10 people who are getting tested for COVID are positive. The good news is we still got lots of testing in the community, and I do encourage people to get tested and to access that testing. And it should be a function of how much people are out in community. The more you're out in the community, the more more frequently you should be tested. But what happens is it takes a little bit of time. Sometimes those testing results will come back within that same week, and great, we can report out on it. Not quite in real time with about a 1 week lag. But as you can see from the gray bar on these charts, in many cases, the data are coming in several weeks later. So even what we think about how many cases we had for that week, the number turns out, in fact, to be much higher. So the take home for people, again, is cases are increasing, things are going in the wrong direction. We need good policy advocacy to require people to collect this demographic data. We want to know the race, we want to know the gender, we want to know, have some idea of where people are, what zip code they're in, so we can monitor the geographic trends. And a lack of data, I always call it the unnecessary and unacceptable omission. On a more positive note, we also have some growing evidence in the world about the safety and effectiveness of the vaccine for pregnant women. This was an issue that hit really close to home in my own house. As everybody knows, I'm a proud grandma of an 8-day-old baby girl, and my daughter had to make the same decision. So what I want to underscore for people is that the vaccine is recommended for everyone 12 years old and above, and that includes women who are pregnant, who are breastfeeding, or who are trying to become pregnant either now or in the future. There've been a lot of questions. Will the vaccine, do something to affect my um, fertility? And it looks like the answer is no. What we do know, however, is that the cells where that the coronavirus binds to, the cells in your body are everywhere in your body. They're in your heart, in your lungs, they're in your reproductive organs. So I always, sort of caution people, if you're worried about the impact of the vaccine on your reproductive health, I would be much more worried about the impact of contracting COVID potentially on one's reproductive health, because that is something that we have not studied at all. So evidence for the safety and effectiveness for the vaccination during pregnancy is just growing. It's been deemed safe. If you look at what the American College of Obstetrics and Gynecology has recommended, we all think it's a good thing. And so these data suggest that the benefits of receiving a COVID vaccine far outweigh any known or potential risks of vaccination during pregnancy. And then the last thing I want to say, and I'm going to treat you all and show you my baby girl. This is baby girl India. Come on. The gift that my daughter gave her is she got vaccinated while she was pregnant. So baby girl India has COVID antibodies. And I know many of us can't relate to this, but the P1 variant was wreaking havoc in Brazil. And many of those women who contracted COVID when they were pregnant, they lost their babies in the womb. Can you imagine getting to 7, 8 months pregnant and you contract COVID? Mom recovered and babies died in their womb of COVID. And they know because they tested the babies once they were born. So I want to make sure that women know this. If you are a pregnant mom, your baby, if you get COVID, COVID will cross the placenta and your baby can get COVID. If you get the COVID vaccine, you will develop antibodies. In the absence of any real exposure, you won't get COVID, but you'll get antibodies first. And your baby will get those COVID antibodies. What a beautiful gift to give to your unborn child, COVID antibodies, such that if you or they ever contracted COVID, their immune system already has a running start to fight it off. So that's the gift that my daughter gave to my granddaughter. And it's a gift that I encourage all pregnant moms to give to their unborn kids.
Well, Dr. Reynolds, Dr. Deborah, what a wonderful testimonial. These testimonials make a difference because this is practical. I do want to ask you though, while we're looking at this little cutie, you mentioned earlier that we weren't getting people's race, ethnicity. From an advocate perspective, would you suggest that if when we go and tell people to go, if they're not asked that question, should they raise it? Say, you didn't ask me about my race, ethnicity? Is there something that, if it isn't mandated or isn't required by law, is it something that we as community can make a difference with?
We could. My only concern is if everybody doesn't do it, it will make more work for us and it won't move the needle and it won't really make the difference. What I think makes more of a difference is for people to write and use their opportunities to speak to their elected officials and say, we want this data collected. It is law. It's supposed to be being collected by law. The problem is there's no enforcement of the law. So I always tell people, think back to when you were a kid or a child and you had a curfew. If you broke curfew and nothing happened, you just continued to break curfew. When you break curfew and then you lose your privileges and your parents say, now you can't go out for 2 months because you came home an hour late. Next time when you get those privileges back, what do? You honor the curfew. So a lot of the testing providers are just sort of like, why bother? Because there's no penalty for not doing it. But I do think it's something that we owe to the community because we want to, I think knowledge is power. We want to be able to say with certainty who's affected, where they are, and make sure we're tending to that there aren't these big differences based on gender or race or where people live. And if they are, then we want to be able to deploy resources appropriately and make sure that all groups are protected, all groups.
Thank you, Dr. Deborah. As we look at this cute little one on this screen, we want to say our goal here is to have a well-informed community. And this is a good example of what good information will do. We had another young lady that said, as a result of her listening to the webinar, she made that decision to get her vaccines. Certainly, we're not forcing anybody. We want to give you good information so you can make a well-informed decision. Thank you, Dr. Deborah. Now we're going to hear from Mary Catherine, who's going to tell us some more about next steps as it relates to the equity brief. Mary Catherine.
Yes. Okay. So first, let me just start by saying if you have any questions, shoot me an email, crawf457 at msu.edu. Okay. So I just want to kick off by first starting out and saying our local and state health departments, and especially right here in Genesee County, the Genesee County Health Department has done a tremendous and really incredible job at leading the way with preventative measures to protect children and teachers. But we're not seeing this all throughout the state of Michigan, right? Some districts are continuing to fall short, districts and health departments, and this because of this climate that we are in of political divisiveness and unwavering attacks on effective COVID mitigation measures due to false beliefs that masks are infringement on civil rights. And so really with no end in sight, it's time for a statewide mandate. Elizabeth Hertel, of the head of the Michigan Department of Health and Human Services, could issue a mandate to keep all children, teachers, and residents safe from the rapidly spreading Delta variant. You know, we can keep and we should keep applauding districts who are making the right and safe choices, but that is simply not enough. We know that the answer is tougher restrictions. That's what keeps people safe. That's what keeps COVID cases down. So the next thing I want to talk about is basically taking you back to last week when I promised that I was going to talk about the need to appropriate these federal relief funds until the legislature actually moves. And here I am. I'm going to continue to discuss that and the consequences of not doing so. So first, I kind of want to give you an update of where we're at right now. Michigan has only budgeted 7% of the nearly $7 billion that we've received from the federal government. And this is just simply unacceptable. The first question that should come to mind is why? I can give you a simple answer. Republican lawmakers continue to resist appropriating these funds while marginalized populations suffer. And I can give you a tangible example. So right now there's $10 million earmarked for foster care resources, but the Republican-led legislature has yet to move this appropriation bill through the Senate, even though that September deadline is looming. So your next question might be, right, how does this affect equity? What's the relation to equity? Well, Black youths make up 29% of the state's foster care system, but only 16% of Michigan's population. So not only is this minority overrepresented in the foster care system, but many of these youths continue to age out while waiting for legislative action, right? And so that means they are losing out on payments for which they would have qualified while policymakers drag their feet. So it's really alarming and disheartening that we're seeing this happen, that it's being allowed to happen when we know and evidence is showing and telling us every week that the Black community is being hit hardest by both the pandemic and health, and by the monetary and health effects of the pandemic. So that's my update and example for this week, and I look forward to keeping you updated next week. Hopefully we'll see some money going out.
Thank you so much, Mary Catherine, for those updates, and keep the examples coming because that's really, really important. I want to just ask Dr. Reynolds if he could come back just quickly, because we had an item in the Q&A about the vaccine records. And the vaccine records, for all of us that are listening there, if you're talking to somebody, if they're out at a community event, they can ask in the especially those persons who are on the mobile unit, to look at their shot record for them. But I wanted to ask and give them that, because that's going to be real important going forward. There are a lot of places who are asking to make sure if you got that vaccine, they want to see a vaccine record. And so I also want to ask you, Dr. Reynolds, we're getting into flu season. What's your tip for us before we leave today about preparing for flu season?
Preparing for flu season. Number one, if you're eligible for a vaccine, get the vaccine. And what I mean is the COVID-19 vaccine. If you're waiting on the COVID-19 vaccine and you have a couple of weeks. Get your flu shot now. It is available in drugstore chains, in the health departments. Call and check. I registered for one of my vaccines at a pharmacy chain, and I got an appointment within 30 minutes. So there is access. Sometimes they will charge you depending on your administration, your insurance and administration fee. Other times you can go to your physician's office. They may have it in stock by now, and check the health department website. Now, since we're talking about grandparents today, let me add, I went and got my tetanus, diphtheria, pertussis shot, my booster shot, because I'm an old guy. I had mine, my last booster more than 10 years ago. So that is something that we must stay aware of, especially when we're cradling our grandchildren. We don't want to pass them on to a newborn or a not completely immunized grandchild. So please, grandparents, let's get on it.
So when you talk about that grandparents, you talk about that like whooping cough.
That's
that
right.
Adults pass the whooping cough off to the child. Yeah.
That's right, Sister Lewis. Thank you for making me clarify that point. That is absolutely correct. So as far as MICR goes, if your provider participates in MICR, and listen to my ifs, if your vaccination has been entered in MICR, you should be able to get a record of your vaccination. If you have no provider, that's where it gets a little more complicated. And I wish we had someone from the health department. I see Sherelle Brown's name. If she can confirm that the health department may be a good place to go to with your identification.
Yes, you can visit the health department and request records. So what I do know is that if you were born before 1994, I believe, some places weren't required to put immunizations into MICR. And so there might be missing immunizations, but you can visit the health department and request those documents.
Thank you. Thank you so much, Sherelle, and thank you so much, Dr. Reynolds. You know, there's just a wealth of information that we would like to make available, so we'll be coming back to you every week. And again, I'm asking you to continue to put those questions in the Q&A, talk to us after, or send us information. But we really want to encourage you. A couple key takeaways today, and that is the information you heard about the match test. Please share it with others and have them practice it. Don't get too close because we don't want anybody getting burned, but we do want you to practice that. And then make sure that we're keeping up with our vaccinations, adults and children. Those records are so important. We want to encourage our community health workers and our social workers to apply for the contact hours for the CEUs. These are available to you. If you are asking us, because you have asked us, let me put it that way, because you've asked us, we want to hear from you. Let us know how valuable this opportunity is for you, so that we can keep moving forward with that. We like to encourage you. Please like us on Facebook. That's www.facebook.com/HFRCC. Join us or subscribe to our Healthy Flint YouTube channel, because we'd love to hear from you again. Email us any questions that you might have to info@hfrcc.org. And please know, you can call us at 810-834-2130. That number again is 810-835-2130. Call us and let us know if there are questions, if there's information, even if you're doing something that you'd like us to share or make it a part, we'll figure out how best to do that. We do thank you for joining us today for this 77th Flint Community webinar on coronavirus, this third day of September 2021. We encourage you, have a safe and wonderful weekend. Stay masked, socially distanced, and watch where you are. Enjoy the weekend. Thank you.